Hey there, I'm Protractor Ved, director in the editorials avenue of our very own Protract Club of Medicrew, and I welcome you all to Roadway to Your Future, our podcast series on the future, pros, and cons of various medical specialties by leading experts in respective fields to help you make an informed decision about your postgraduate choice. Today, we have with us Dr. Yogesh Zanwar, renowned pioneer in dermatology with 25 plus years of experience, speaker at 3 international and 17 national level dermatologist conventions, awarded for his contributions by the Indian Association of Dermatologists, Venereologists and Leprologists, beside Indian Association of Cutaneous Surgeons. He also has actively worked in the areas of tribal welfare and artificial intelligence in dermatology. Sir, it is our utmost pride to welcome you here.
Hello, thank you, Ved, and thank you very much for inviting me for the talk on scope of dermatology as a postgraduate choice. First
Yes,
of all, I must congratulate you for such a kind initiative, which can help students to have a insight in the specialty.
yes, sir, that's very kind of you. Sir, to start, could you please tell us about the current trends in dermatology in brief?
Right, Ved. I see current scenario of dermatology is one of the specialty which is the most preferred by the PG aspirant. In fact, because of this most of the time goes into the pocket of top rankers only. Over a period of time, more and more people are preferring this specialty. If you look at the scenario in India, there are around 18,000 qualified dermatologists and approx might be around 11,000 might be practicing. And that makes one dermatologist for 1.3.5 lakh people. This ratio only tells us that there is a huge scope in India. Apart from this, if you look at the literacy level is increasing in India, so the awareness is also increasing about the skin issue. As the Indian economy is growing, so more and more people are opting for the treatment of many neglected skin issues as well. Apart from this, the social media, which is compelling people to be having a healthy, beautiful, younger skin. So in current scenario, the coming future, there is a very good scope for this specialty.
That's actually very insightful. Could you please kindly elaborate on the pros and cons of choosing dermatology or its allied branches as a field?
Right, right. So there are more pros than the cons in this field actually. So let me take you to some of the pros first and then the cons. The first thing which I like the most about this is diversity in cases. That means you have a cases ranging from like simple condition like acne vulgaris to a rare condition like Steven Johnson. You have a cases like acute urticaria which need to be have an emergency management to the chronic condition like psoriasis. You have a glamorous cosmetic conditions and you have a venereal disease. So there is a good diversity of cases and that makes this specialty a very interesting to me. Here you can also have a surgical and as well as a medical treatment. So you can satisfy your appetite of surgery as well. Second point is that it has an impactful work. The proper diagnosis of yours can change the treatment line. For example, suppose a person is admitted in a ICU having a rash and the physician is in a dilemma whether the rash is of dengue or whether the rash is of drug induced. So, as a dermatologist, that clinical presentation of rash, you can make out this is not a dengue, this is not a drug rash, or this is a dengue rash. So, your uh, dermatology knowledge is going to make a lot of difference in the treatment guideline also. Apart from this, if you look at, there are a very good patient satisfaction. There is an opportunity to interact with lot of patients on a daily basis and easy to build a good rapport by providing a genuine care is there. So there is an opportunity to educate patient about their self-acceptance and ultimately it is an amazing feeling to see the patient getting better. and showing the gratitude to you. If you take another plus point, there is a work-life balance is very good in the specialty. All youngsters are most of the time asking for there is a not a good work-life balance in the medical field, but if you look at the dermatology, there is a plus point over here. You have a liberty to maintain a good balance in that life. You can have a fixed working hours. You have a limited on-call responsibility. You hardly have to have emergencies, and you can have a personal interest. You can give a good time for your personal habits also. So apart from this, you have a less stressful working environment in the dermatology. And if you look at it, either you can have your own clinical practice, you can opt for the government hospital setup, you can just join the corporate hospital, you can have a teleconsultation, you can just go for the academic research institute. You can also think of joining the pharmacological company for research and development. So you can think of like various things in this specialty. Apart from this, you have a many specialty in this field, like pediatric super specialty, I meant to say, like pediatric dermatology, dermatohistopathology, teledermatology, dermatosurgery, trichology, venerology. So you can be a specialist of particular specialty, super specialty. Now coming to the next pro point, there is a growing demand. As I already covered in the initial introduction part, there is a global rise in the skin condition. There is a global rise in the demand of the dermatologist also. So there is a blooming interest in the cosmetic dermatology as well. The number of people who can afford to the this kind of treatments are also increasing. So there is a growing demand for this specialty. Now coming to the earning point of view, there is a good earning in this specialty. So if you look at the scenario, like if there are many few specialties who earn more than the dermatology. If you look at one of the papers, apart from plastic surgeon, cardiologist, gastrologist, and radiologist, the dermatologist comes the sixth as far as the revenue is concerned. So they are much ahead of the many of the specialty like pediatrics, medicine, nephrology, psychiatry. So that's the plus point in the choosing the dermatology. Now, even if you consider the setup of a clinic, so you don't need a huge area to build a hospital. You just need a small area where you can have a, like a 1,000 square feet and you can have a good aesthetic looking setup. So fewer legality will be required as compared to the hospital, and you can have a multiple chain of clinic of your own. Apart from this, because of the you can say like coming, there's lot of artificial intelligence is also going to come. So this is one of the specialty which is going to utilize it to the optimum level. So you can just click the image and upload it. The AI will help you to come to the diagnosis and the treatment guideline with much precision. So that's again a plus point as far as why you should be preferring a dermatology. Yes, there are few cons also. Some of them are like it is very difficult to get the admission in. Right, everyone want to be a dermatologist, so very few people are able to get it as the number of seats are very less. So you need to have a very high rank. Second negative, or you can say a con of dermatology is a competitive field. Nowadays, we are facing a lot of issue of quackery in the dermatology. Means the people who are not qualified, either they have done homeopathy, Ayurvedic, physiotherapy, or a dietitian, they are also starting a aesthetic setup and projecting themselves as a dermatologist. So that are some of the 12-month courses become a dermatologist. So there is a rise in the competition as far as the number of dermatology clinics is concerned. Sometimes you may not like to have a repeatedly seeing the same fungal infection, acne, vulgaris, and hair fall. Sometimes you may not be comfortable with keep watching the venereal disease, and exposing yourself to the infection is also one of the negative points in dermatology, choosing dermatology. One thing which I feel which is a very important is you don't have the very much critical care experience in this way. So that is something negative. Yes, you need to keep a balance between the medical and the cosmetic aspect here. Sometimes nowadays you have to deal with a patient with unrealistic expectation. People may come and they may want to have a fair color, which may not be realistic for a dermatologist to give that outcome to the patient. And do not forget there is a rising number of medical legal issues in the dermatology is there. One of the most commonly you can see the medical legal issues are more common in a dermatology and more so in a aesthetic practice. So that is to be kept in mind when you are choosing the dermatology. So I think like it, you've got a rough idea about there are many pros and few cons about the choosing a dermatologist.
I know that was quite very insightful. Could you please tell if you would recommend someone to choose dermatology as a field for the future?
Right. If you say overall per se, if you consider these pros and cons, I will prefer to choose this as a good specialty for the newcomers. If you look at the scenario like it, what we most of the time like the Bollywood movie with lot of suspense, action, glamours, and music. So as a dermatology specialty, there is a good suspense is there, a good action is there, good revenue, music is there, and the outcome because of the newer biologics and laser is very good. So with the movie is ending with a good end also. So overall, my choice to the people like it. Dermatology is a very innovative, very interesting branch and a very rewarding if you are a good clinician, if you are a good dermatologist, you can help the patient, you can change the treatment line of a patient and the good outcome you can be providing to them.
Thank you so much, sir. I must say, this conversation has been truly enlightening for me and medical students like me alike. This shall help us make an informed decision about our future for sure. It was an honor to host you on our podcast by Rotaract Club of Medicare. Thank you.
Okay, thank you.